Can we predict good or bad outcomes of low back pain? Most episodes of low back pain will disappear and do not require any other treatment than advice, reassurance and some education based on a thorough examination to rule out serious pathologies. However, there are some findings in the literature that indicates a potentially increased risk of experiencing disability due to low back pain. So here's a list of evidence-based findings which could indicate a higher risk of disabling low back pain. 1. Has the person had previous episodes of low back pain, or is the current episode with very intense pain, or is there an indication of nerve root involvement in the pain? 2. Does the patient generally have a low level of physical activity, a very high body mass index, or is the patient a smoker? 3. Does the patient have a diagnosis of depression? Is the patient afraid of the pain, or does the patient think that the worst outcome is the most realistic outcome? 4. Hard manual labor, or feeling unsatisfied with the current job situation, or even thinking that they cannot or should not work because of pain. And 5. That the patient has no education or an education lower than college level. From a clinical perspective, it is important to remember that all these factors do not automatically suggest that any patient with any or all of these factors will present with disabling low back pain. They are simply factors that should help you decide which patients may need a little more attention or who should be followed up more frequently. However, it is very important to remember that while these factors may indicate an increased risk of a poor outcome, treatments should also not automatically be targeted to these factors, since no causal relationship between them and pain has been established. In summary, some patients will present with one or more factors which are known to increase the risk of disabling low back pain. The problem is not the factors themselves, so you need to find out from your patient if, how and when their pain is disabling them, in order to suggest relevant solutions. Find more videos from P4Work on Facebook and YouTube.